Civil society organizations have an important role to play in policymaking processes, bringing thereby their expertise and evidence, but also carrying the voices of citizens. And in the case of health, also patients, healthcare workers, and others. Enabling participation in policymaking strengthens the legitimacy of the process, which makes it essential to provide civil society with a seat at the table. Policy-making processes in the EU are set by the Better Regulation agenda, including stakeholder consultation exercises. And for civil society, participating in policy-making processes through the Better Regulation tools is a way to contribute to evidence-based policymaking, which is core to EPHA's vision. The current narratives of better regulation tend to strive towards cutting red tape, and civil society's role, therefore, is in shifting the narrative and making sure that better regulation works better for health through policymaking. And that is why EPHA focuses on this issue as part of its civil society engagement work. And it is also essential to provide civil society with tools that allow them to participate in the better regulation processes, and thereby we can level the playing field with other better resourced stakeholders that promote commercial or health harming interests. EPHA advocates on the better regulation agenda by engaging on the topic of civil society engagement and on placing health high on the agenda. We also do so by taking part in the consultation exercises that are relevant to our work. One of the key aspects of our work on this topic has been our participation in the Better Regulation for Better Health project, which allowed us to develop capacity building workshops for our members and our team, all in order to strengthen civil society's participation and weight in the process, making us better heard. We are also working on improving health policy making and civil society engagement by collaborating with our members, partners, and networks, especially through the EU for Health Civil Society Alliance. There in the Alliance, we work to strengthen the place of health on the political and policy agenda, but also we call for a better civic space and sustainable funding for health civil society, making sure that we can bring a stronger voice to the table. We have in the last year called for these priorities in the election campaigns of both EPHA and the EU for Health Civil Society Alliance. And we are also collaborating with civil society from other sectors through our participation in the campaign Civil Society for EU, which calls for stronger civic space. The goal is to support civil society in building capacity to take part in the paths for participation that are planned by the Better Regulation agenda. So the toolkit provides tools and keys for an improved understanding of the Better Regulation agenda, thereby supporting health civil society to maximize their impact in policymaking. The toolkit starts with explainers presenting key elements related to the Better Regulation agenda, its tools and narratives, and also stakeholder participation. Some elements on how better regulation processes affect health are presenting, as well as the use of better regulation by the industry. The toolkit also contains summaries of key research on better regulation, which deepens the understanding of specific elements of policymaking, such as the impact assessment. Then also the projects outputs are available, supporting understanding and capacity building, and that includes the key takeaway from the capacity building workshops and the project's report with advocacy recommendations on better regulation. And finally, there is a repository of useful sources, which then allow a deep dive into the topic.